Hi everyone, so I'm back with again a video on disease that is Hirschsprung's disease. It is actually the disorder of intestine, large intestine, which is usually congenital. That is, it's present by birth. So, before going forward to the Hirschsprung disease, we will have a look at the anatomy of the large intestine. We usually know that our large intestine has three parts: cecum, colon, and rectum, and we have that colon divided into ascending colon, transverse colon, and descending colon, as well as we have a part which is called as sigmoid colon, which is sigmoid shaped, S shaped, and nearby that is rectum. In a normal human being, we have submucosal plexus in submucosa and myenteric plexus in muscularis in the GI tract, usually in large intestine as well. So what happens in this disease condition? There is absence of ganglionic cells. The nerve cells are absent in both these plexus. That means in the submucosal plexus as well as in the myenteric plexus, there is no ganglionic cell. That area is aganglionic. So, Hirschsprung's disease is actually a congenital malformation of large intestine in which there is absence of ganglionic cells in the submucosal and myenteric plexus of intestine. We can say directly that means there is deficiency of the nerve cells in these plexus of intestine. And when there is deficiency, so what will happen? There are aganglionic cells, and there will be improper peristalsis. We can say that this disease usually affects the distal segment of the colon, or we can say sigmoid colon. It can also affect rectum. It depends on the level. So lack of peristalsis leads to obstruction of colon, and then there is the accumulation of gas and feces proximal, that means nearby to the defect. We have levels of Hirschsprung's disease depending on whether only a rectum is involved, part of rectum, or sigmoid colon and rectum, or first third of colon. So we have the three types. Then we have directly we are moving forward to the clinical features. In the newborn, a failure to pass meconium. The newborns will not be able to pass meconium within 48 or 42 hours. There will be abdominal distension. Also, there will be vomiting, bile stained. In the later cases, there can be shock, diarrhea, constipation can also occur. In older adults, we will usually see abdominal distension and malnourishment and anemia and foul smelling stool. Then coming to the pathophysiology, it's due to the absence of ganglionic cells, there will be lack of peristalsis, which I told you in the affected portion, and which will lead to further functional obstruction. When there will be no way to pass on gas and feces, they will get accumulated near to the defect, and there will be formation of megacolon. That means the colon will get abnormally dilated. Rest discussed in part 2. Thank you.